The World Health Organization, Joe, announcing last week that the end is in sight for the COVID-19 pandemic. Weekly deaths globally reached their lowest rate since the beginning of the pandemic back in March of 2020.
President Biden then doubled down over the weekend, telling 60 Minutes, quote, the pandemic is over. Now, there have been nearly 96 million cases of COVID here in the U.S. in the last 2.5 years. More than 1 million people across the country have lost their lives because of the virus.
Joining us now for more on is NBC News medical contributor Dr. Kavita Patel, who I call with literally every single COVID question I've ever had, and she will attest to that. Dr. Patel, you know, we look at the numbers right now, and you see in the U.S. they've stayed relatively flat, but it's still averaging more than 500 deaths for the last couple of weeks. So how does a pandemic officially come to an end, and how are we getting close to there?
Sam, that's the, I guess, trillion-dollar question when you think about how much is at stake and what the president stated over the weekend. The end of a pandemic is not this clear, bright line like moving from one state to another or changing a time zone. It's actually a kind of a combination of dimensions, and a lot of them are psychological, and I think that's what the president reflected. But we're still not at the end of it because we don't have kind of a regular seasonality that we can expect. We don't know if and when a next surge might happen. And then I think on top of that, you're right, 400 to 500 deaths a day. That might be where we are at kind of permanently, but we just have too little information about the future, the near future even, the 6 months to know that.
So as we move forward, is it likely, do we think, that COVID is going to remain a leading cause of death in the U.S., or is there hope that this new shot, whether it's your third shot, your fourth shot, your fifth shot, this new one that's out there is going to have a decent impact on those numbers?
Joe, I wish I could say that people would take those shots. Absolutely. If people did kind of stay up to date, as the CDC calls it, which includes this most recent booster, which has unfortunately not had that robust uptake that we see when we have new vaccines issued. If we do not get those numbers to move, then we're sadly going to continue to have COVID be not just in the top 3 leading causes of death, which is what they were in 2020 and 2021, but really like just kind of forever sealing what the fate of our country is and the world, because we're talking about COVID like we're talking about conditions like heart disease, stroke, cancer. And I hate to say it, in fact, all of this could be prevented with a combination of vaccines and access to treatments. But I know, Sam, you and Joe both know that easier said than done. It's not actually easy for patients and consumers to navigate some of this, even when they want it.
Right, and creating the urgency to get people to actually get those vaccinations as well. We've been talking about that for a long time. Dr. Patel, I also wanted to ask you about a study that focuses on people who had COVID 2 years ago in Wuhan, China, which, of course, is the origin of the outbreak. It found that about 20% of them continue to have symptoms even today. Is that something that we should be concerned about here in the United States?
Yeah, this brings up, people have been calling this long COVID. The technical term is post-acute sequelae of COVID. That's what we say in the medical kind of literature. However you call it, though, what you point out, Sam, that we're seeing people years later who are still symptomatic. And that's in adults, about 15 to 20%. That's consistent with literature across the world. Fortunately, in children, it's a lower number, but I would just put forward that any number is one we shouldn't accept. And this, again, when we talk about cancer, heart disease, and stroke, think about the research and decades of work that has gone into understanding that. We are just in literally years of trying to understand and unpack long COVID, and it's affecting people's lives today. So we need to put way more attention to it than we have in the past.
No doubt about it. Thank you, Dr. Patel. Appreciate that insight.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.